Morning, everyone.
Morning.
It's like classroom, isn't it? Good morning, Queenslanders. I can update Queenslanders that we have 2 new cases today. One is an interstate arrival in hotel quarantine, and the other is an overseas traveller in hotel quarantine. So no new cases in the community, which is fantastic news. That leaves us at 40 active cases currently, 11,056 tests in the last 24 hours. So thank you for people who continue to come out and get tested for any symptoms, and 12,258 vaccines. So really great numbers over the last 24 hours for vaccinations. That puts us at 87.53% for first doses and 79.11%. So close. Keep up the great work. If you are due for your second dose, of course, come forward. But we still have around 13% of the eligible population, 16 and above, who are not vaccinated for 1 dose yet. Now, I'm going to give a big shout out to our seniors and particularly our 70 plus. We are at 98.99% first doses for people who are 70 plus in Queensland. So that is just fantastic to see those results. And 94.91% double dosed, and our 50 above are now at 94.44% first dose and 89.81%. So I don't want to refer to 50s and over as seniors because I fall into that category. So can I just say for those who are 50 and above, you're certainly pulling your weight as far as getting vaccinations, and it really is our 20 to 39-year-olds where we have a larger proportion who are still not vaccinated for 1 dose. So please come out and get vaccinated. As we get closer to our opening up our borders to people from hotspots on Monday who will not need to quarantine, and of course as we get closer to the 17th of December as well, where the social measures for our mandatory vaccination businesses take effect. There is some news in relation to a couple of our overseas cases. So our gentleman from Nigeria, who is in hotel quarantine in Cairns, in which we put up the flight and the Cairns airport as a hotspot, I can advise that our sequencing has shown this is Omicron for this individual. I also can advise, and so that now means everyone on that flight has been deemed to be a close contact, not just those who are immediately seated around this individual. Having said that, these people, because it's a direct flight from Sydney, should all be in some form of quarantine unless they are transiting on elsewhere. In relation to the case we mentioned the other day from South Africa, where we had ruled out it being Delta, but we were still working with the International Committee as to what this actually is. We can say, and I want to give a huge thank you to our forensic scientific services, because it is their work, working with the International Committee, that has led to the International Committee now actually reclassifying Omicron into 2 lineages. And we have both of them here in Queensland. So the gentleman the other day has been defined as having Omicron-like, L-I-K-E. That is the new lineage that, and the name that will be given to this variant that has been identified and confirmed by the International Committee. I'll have Dr. Aiken just talk about that a little bit more. I just want to also, as we stood up yesterday and we talked about supporting small businesses and releasing the Public Health Directive on the mandatory vaccination for various sites and businesses come the 17th of December. I'm seeing a bit of chatter on social media that there is a view that businesses have the option of opting out and staying with density limits and COVID-safe plans instead of the mandatory vaccination. That is incorrect. Can I make it very clear? If you are defined as a business that requires your staff and your patrons to be fully vaccinated, then you are bound by that directive. You cannot choose to follow that directive. It is a lawful direction to do that. So I hope that clarifies it for businesses and patrons who think that some businesses can choose to just stay with the existing conditions. that won't be correct, and come 17th of December they will be expected to comply with that directive so that we can keep people safe and their patrons know they're going into a fully vaccinated site, no matter where the pub, club, hotel, these venues are anywhere in Queensland. I'll pass over now to Dr Aiken to just talk a little bit more about these cases.
Thank you, Minister. And as you've heard, 2 new cases today. One of those is a domestic returnee from Melbourne. They're day 12 in quarantine. They're part of a large family group that is all basically tested positive, and they're in hospital with the rest of that family at the moment. The other one is an international arrival, day 0 in hotel quarantine. They will have been infectious on the flight. We're following the normal pathway there at the moment to make sure that flight is followed through. The other thing, obviously, is the case in Cairns, and that is Omicron positive, but we're working through that whole case, the whole flight, and identifying anyone there, and that's underway at the present stage. The new classification of Omicron that the Ministry referred to as well, look, this is amazing work from our Forensic and Scientific Services team. They've picked up the differences here, worked through it in a methodical and scientific approach, recognised that there are differences between the full and normal Omicron classification, passed that on to the International Committee in a really quick time frame, and it's now led to a reclassification of Omicron. The important part is that those 2 sublineages, one has the S gene dropout that we've talked about, and is the normal means of screening for Omicron, but this other strain then doesn't have S gene dropout. So it's going to lead to improvements in people recognising the potential spread of Omicron in all communities. So that's a great international contribution from the FSS teams and great work from them. The other thing, that's a South African traveller, I should say, not the Cairns traveller, just in case of any confusion there. But with the arrival of Omicron, we now have Omicron and Omicron-like. And it's a reminder to us all that as we open our borders, this doesn't mean that the COVID journey is finished. In many ways, the COVID journey is just starting. This is what we've looked at and what we've talked about from the start, about flattening the curve. We've been able to flatten the curve to have vaccine development. We've now got vaccine rollout to 80%. But as we enter this next phase, we're moving from elimination to suppression. And before we live with COVID, we have to go through that suppression phase. We will have cases. It means that we will have to look at mask wearing. We will have to contact trace. We will have to have quarantine for close contacts. We're working through the quarantine period, particularly for fully vaccinated people. But it also means that there will be interruptions to people's life. Please don't think that we're going to go from elimination to living with COVID in one simple flick. This is going to be a difficult period. Cases will come in. We expect those to peak, as we've said earlier, sometime between March, June, those sort of things. The most important part, though, is the more people we get vaccinated, the lower the case numbers will be, and the less people will be in hospital, will be in ICU, will die. And that is so important. Just to use some numbers from the New South Wales outbreak, and remember New South Wales had 61,000 cases between June and October. Of those 61,800 locally acquired cases, 5.7% of the people that were hospitalised were fully vaccinated. 3% fully vaccinated ICU. The rest of those people were unvaccinated. So it makes an incredible difference to individual health and the workload on our hospitals. And that's the really important part, that we can preserve the health system and look after everyone who needs their appendix out, has their heart attack, everything else. And we need your help as the community to do that. To give you an idea of the rate of people getting COVID in New South Wales, that peak rate, if you were unvaccinated, was 561 people of 100,000. If you were fully vaccinated, it was 49.5. That's an incredible difference in the effectiveness of the vaccine preventing people getting COVID, which is, we know it still lets people get COVID, but tenfold difference. That's an enormous reduction. And then an absolutely enormous 95% reduction in people getting or needing hospital or needing to go to ICU. So we'll keep saying it. If you haven't been vaccinated already, please get vaccinated. It's not too late. Thank you.
Yeah, the 2 Omicron cases, where are those?
So the Omicron case in Cairns is in hospital in Cairns at the moment. So once they tested positive, they've been moved from the hotel quarantine in Cairns to Cairns Hospital, and we may move them to Townsville yet. That's just being worked through at the current stage. and the other patient with the Omicron variant is at hospital in Brisbane.
How sick are they?
They're both well.
And can you explain just the difference in these two Omicron variants? Obviously there are two different strains, but what does that actually mean in terms of how the disease affects you?
Look, it's still too early to tell on that, and that's what a lot of the work is. All we can do at the moment is the classification on genomics. There's, as has been out in the media and out everywhere, there's about 30 different variants or gene changes in normal Omicron, to call it that. This other one, the Omicron variant, has about 14, so it's got about half of the gene changes, and so it's got enough to be able to classify it as Omicron, but we don't know enough about it as to what that means then, as far as clinical severity, vaccine effectiveness. What we do know is that it's looking like Omicron is more infectious and more transmissible. What we don't know yet is degrees of clinical severity or vaccine effectiveness. What we are seeing, but it's too early to say, is that it looks to be a less severe illness, Omicron, but remember also that the severity of illness lags about 7 to 10 days behind case diagnosis. So we need to wait for that to happen to get the full information.
Why would that man be moved from Cairns to Townsville?
Simply as far as capacity and the ability to provide a higher level of care in an ICU that's accredited for COVID care at this stage, just in case. Much easier to move people if we need to in advance rather than waiting for any change.
Is the Cairns ICU full at the moment?
Cairns ICU is always a struggle. Remember, it also serves a large population in the Cape.
Is that worrying moving forward when we open the borders that ICU is already at capacity?
Look, it's part of the ongoing development, and we're doing that and working with all our hospitals to make sure all our hospitals are able to receive COVID cases, and we'll expand our COVID hospital designated network as part of that.
Obviously these are the first Omicron cases detected in Queensland. When did you or the Queensland Health first become aware that it was Omicron and you notified?
Last night. But we need to get confirmation and work through the normal process.
There's a question with PPE. At the moment, health workers that come into contact with COVID cases have to isolate for 2 weeks if they're not in the full get-up. When the border opens and it's more likely that these health workers are going to be coming into contact with cases, will they be required to wear full PPE all the time, or will those requirements be
Look, we'll
reduced?
continue to use the same processes that we have already, where we have high degrees of transmission in the community, we escalate our PPE requirements, low, moderate and high, and that'll be based on the COVID load or prevalence in the community. And the other thing we're working through is just the quarantine requirements for any health workers that may be exposed. And that depends on not just their PPE, but whether there's breaches involved and whether they're vaccinated. So, normal process.
Can you please clarify, if you're unvaccinated and when the December 17 restrictions come in, how do you pick up takeaway food? Do you have to go inside the shop, outside the shop? What are the requirements for that?
For takeaway food, again, unvaccinated can still access those services, but they should be doing it outside. And that'll depend on the local arrangements, but we don't want people going in and sitting down and being more part of the sit-down arrangements, potentially exposing others.
And when
Ideally, that'd be lovely if they wore a mask.
Okay. Will you release the details about the quarantine requirements come Monday? Will we just adopt what New South Wales and Victoria are doing, for example?
So you're talking about quarantine
For
requirements?
close contacts, casual
Look, we're
contacts.
working through that at the moment. We'll hopefully have something out very soon. There's been some documents in the final stages of sign-off and working through with our public health unit. So we're getting the experts to look at that as well as the national groups.
The health directions say that children over 12 months need to get a test.
Yep.
What's the difference between an 11-month-old baby and a 13-month-old baby?
Under 12 months, ideally a saliva test, but after 12 months, a deep nasal oropharyngeal test.
Is that a requirement for the under 12 months to get the test?
Look, there will be circumstances where children under that age may not be able to, and we recognise that, and that'll be on a case-by-case basis.
But by and large, people coming into Queensland under 12 months will have to get a saliva test.
Under 12 months, yes.
So where do they get that test from?
Any testing station. So obviously some stations prefer to work with adults only, but
So that is a requirement. If say a 6-month-old baby, they have to get a test.
6-month-old should be a saliva test as far as the entry criteria.
There's actually in the requirement that they have to get a test.
My understanding it is, yes.
Questions for the Minister of Queensland? Dan Tier this morning predicted that Australia's international tourism industry would return to pre-pandemic levels by next financial year. Is that something that you think will happen in Queensland? Will it take
Oh,
longer?
Look, we hope to return back to normal as soon as possible, but we're going to do it in a safe and responsible way, and we're going to make sure that we can do what we can to slow the virus. I'm very proud of the arrangements we have in place at the moment, which has meant that the international rivals we have who are coming in positive are quarantining here. So for the individual in Cairns, they had been in Sydney first and then come up here within the 14 days. So because they weren't required to quarantine for 14 days in New South Wales, they travelled up here. So thankfully, because we still have our quarantine arrangements, that meant that we were able to identify this first case of Omicron in quarantine arrangements and not in the community. But look, time will tell. It depends on how quickly we get to those higher rates of vaccinations. It depends on how many cases we have coming into the community. It depends on the level and the seriousness of illness of those people and how many are ending up in our hospitals and in ICU. We will work through all of that, but we want to do it, as I say, in a very safe way, and our plan has been laid out as to how we transition to that.
Are you comfortable with the fact that a COVID positive case can't be in Cairns ICU because it's full and they might have to be moved to Townsville?
Oh, it's not just about, it's not a can't. These are clinical decisions. We've moved people around who are positive cases throughout this pandemic for a whole range of reasons as to suitability of care and everything else. We know when the virus starts popping up everywhere, that every hospital is going to likely to see positive cases and they're going to have to manage those. Now, some of those people who end up very unwell may very well have to be moved to different hospitals and different arrangements. I don't want to say that Cairns Hospital is not up to it, because we have excellent expertise in the hospital and facilities there, and we have managed positive COVID patients in the Cairns Hospital throughout the pandemic. But these are clinical reasons as to why someone might be moved.
The acting judge said that it's struggling and that these people aren't sick. So why would you be moved there?
Well, as I say, these are clinical decisions, so I'll leave it to...
Capacity, like the acting judge said?
Look, all of our hospitals have demands, but I'll let the Chief Health Officer just explain.
Does this guy have to go into ICU in Townsville?
No,
Okay.
this is very much just a preemptive move. If we do move him, it's simply because the way the quarantine arrangements are and to manage capacity is that a single patient, remember we don't have COVID patients in mixed wards, and it's balancing that capacity to maintain the care to the rest of the community, as well as make sure he's looked after in a safe and appropriate environment.
But he's one case and you have to move him.
And
What are you going to do
quarantine hotels
come
in
next
Cairns.
Monday?
Yeah, remember that there's our quarantine arrangements in Cairns, there's a smaller number of beds, but because of the arrangements, we also have to move a number of other patients. So this is just a safety move and to manage capacity. It's not defined as happening yet either. This is just making sure, and we're looking at the
How
options.
is he being moved? Is it on a private jet?
He will be moved under the normal.
Expensive to fly.
He will be moved under the normal arrangements if he is moved, the same as we've moved patients from Cairns to Gold Coast to Brisbane previously.
Minister, can I ask?
Rob Skelton, in an email to a number of people, has said that the Day of Atonement is coming when speaking about COVID. Do you agree with that?
Oh, look, I haven't seen that email. I'd rather see the email and see what he's actually said in the context around it. But Rob can speak for himself. If we really want to talk about commentary, if we want to talk about anti-vaccination sentiment and what we are seeing in the community, because I'm aware Rob is vaccinated. He's not an anti-vaxxer. But the comments we are hearing from federal members of parliament and George Christensen particularly, and some of these extreme mediums that he is using, I have to say, like federal members of parliament being asked right now, do they condemn George Christensen's behaviour? I absolutely condemn his behaviour. The Palaszczuk government condemns his behaviour and his rhetoric around the vaccination and the virus. And David Crisafulli should condemn it. Scott Morrison should condemn it. And the question should be, why is the LNP not removing him from the party? He should be sacked from the party because of this rhetoric. This is dangerous. For 2 years, we have fought to make sure the community are aware of the risks of the virus and the safety of the vaccine. And we have an elected member of the House of Representatives and of the Senate in our federal parliament undermining this work. And we hear crickets. We hear crickets from Scott Morrison and from David Crisafulli. And I just find this appalling. Leader of the opposition here in Queensland not just hasn't come out and condemned it, but actually had a fundraising event in recent weeks with George Christensen authorising the materials and the flyer for that fundraiser. That is appalling. We are in the middle of a pandemic. We are about to start the most difficult part of our transition, opening up our economy and having cases increasing throughout our community. People will get sick, people will end up in hospital, people will end up in ICU, and sadly people will lose their lives because of this virus. And we have David Crisfolli and Scott Morrison just remaining silent on an elected member making these comments. So, you know, before we start talking about an email from Rob Skelton, I think we should be having a look at this behaviour of George Christensen. That's not a one-off email. It is ongoing, dangerous behaviour.
Minister, on the quarantine rules, why don't we have a plan though? You've announced the border reopening date, but why don't we know what we're going to do with close contacts or casual contacts?
Because we,
and adopt what
yeah,
New South
it's,
Wales and Victoria
well,
are doing? I just don't
all
understand
due
how you
respect, New South Wales and Victoria are not leading the way on managing the virus. Can I say that now?
But when we
Queensland has led the way in keeping the virus down. I had a look at the figures the other day. New South Wales and Victoria combined have had over 200,000 positive cases. 200,000 positive cases. We've had just over 2,000. So I'm going to take the advice of our health officers, not just simply look at what New South Wales and Victoria are doing. The case we announced today as an interstate arrival who is positive is day 12. Day 12. So let's not be too quick to say, oh, well, you should be able to go out after 7 days. Let's take the advice. Let's do this properly. Let's make sure we can do it in a safe and responsible way. So we are looking at whether we can move to a lesser quarantine period for close contacts, but we will do it on our Chief Health Officer's advice and the best evidence and seeing what's happening here in Queensland.
Why don't you have the plan when you release the border reopening date?
Because it's not just about the border. It's about...
But the cases are coming in with the border reopening and you don't have a plan of how to deal with...
Well, let's put it this way. Our current position is safer. So you're saying, why aren't we reducing...
No, where's the plan?
No, but you're saying we should have a plan to potentially move away from the 14 quarantines from the moment we let this virus into our community. Let's do this carefully. Let's make sure, at the moment it's 14 days. Let's wait and get the proper advice. These are discussions, and I want to make this clear before it's criticised that Queensland's somehow doing something different. These are discussions that are still happening with the Communicable Disease Centre nationally and also with AHPPC. This hasn't been finalised. It's not a national position.
The question, I guess, then is why is this still ongoing when the border's opening in like 4 days? How come a decision hasn't been made either way?
Because the decision is this. We have 14 days quarantine currently. And until that changes, we have 14 days quarantine. So it's not like it's up in the air. It is 14 days quarantine until we get advice that we should change that. But I hear Dr. Aiken would like to say a few words. So.
And look, yeah, the position, as the Minister put it, is we have 14 days quarantine, and that has served us so well when we look at the other states and where they've ended up in, particularly some of the recent arrivals into New South Wales in particular with the Omicron spread. What we're trying to do is stay at 14 days. We are looking at reducing quarantine for close contacts under certain conditions for fully vaccinated to 7 days, but we don't want to jump out and do that yet. We've got the plan and arrangements for that, but we need to see what Omicron does as well. Omicron may change that, and the worst possible thing for our community is to put that plan out in its current thought, change it back to 7 days and find Omicron changes that and we have to bring it back. It's much better to stay in an existing position which we know is safe at 14 days quarantine than change and then have to move back. It's as simple as that.
When do you hope to have an outcome or release what that will be?
Can I say, National Cabinet's meeting on Friday. The Premier has said all along she'll be guided by the Prime Minister and the federal health advice on Omicron. So there's a National Cabinet decision on meeting on Friday. Let's wait to see what further information comes out.
Do you know whether it's a priority of the Premiers to discuss at National Cabinet?
Oh, well, I know they're discussing Omicron and what the consequences are and whether that changes what we are doing at a national level and at individual state levels. I mean, this is a new variant. Remember, it's only 8 days since this has become an issue for Australia and other countries. And now today we are standing here announcing a new version of Omicron, and it's a first in the world. It's a first in the world. So just let's make sure we do this safely.
There might be a few people worried then watching in New South Wales and Victoria. Can you confirm there's no changes to the border reopening or restrictions?
We stood up yesterday and said very clearly, yeah, no. It doesn't change. We are opening up on Monday as we planned, 1 a.m. The borders will open 17th of December, and your social measures will come into place.
Do you know what day this month WorldCamp will open?
No, I'm not aware of the specific date.
Queensland's biggest industries like mining, tourism, international education has traditionally been quite reliant on our relationship with China. Given that, do you have concerns about the Prime Minister's announcement this morning that Australia would follow the US's lead with the diplomatic boycott of the Beijing Winter Olympics and how that's going to affect Queensland industries?
Look, we certainly support our athletes and welcome that they will be attending those games. As far as any diplomatic attendances at those events, that is a decision for the federal government.
Do you support it though?
Pardon?
Do you support that decision?
Look, it is a federal government decision. I'm not going to get caught up in playing politics around those issues. That is a decision as to whether the Commonwealth sends federal diplomats to those games. But we welcome that the athletes are attending.
Do you expect it will have some sort of flow-on effect to Queensland industries though?
Oh, look, this is a very new announcement, and I'm sure the Trade Minister and the Premier, will have the opportunity to consider that. But right now, this has just been announced.
Is it still safe to bus people from Brisbane Airport to WorldCamp with this new variant?
Look, we will look at all of our circumstances. We have done an incredible job of containing this virus in our quarantine arrangements. WorldCamp will make it safer. As I explained yesterday, when we put people into hotel quarantine, especially if Omicron ends up like Delta, being able to be transmitted across corridors simply by opening doors, we know that is an issue. So by being able to move to WorldCamp where there isn't those closed-in corridors will actually make it a safer environment for quarantine arrangements.
What about an enclosed bus though, taking people from the airport to...
Well, people still have to be transported. We're not going to start transporting people one by one in quarantine arrangements, but we will take all the precautions that we normally do to ensure that we reduce the risk as much as possible.
And the Omicron-like variant of this one you've announced, is this the first time in the world?
The work that our forensic scientific services have done in identifying this variant and communicating it with the International Committee, as I understand it, the International Committee have overnight declared that it is going to have a name, and it is a Omicron-like, and that is going to be its official name. So yes, it's a first. And it may be that others will now be able to identify this now that we know what its makeup is.
Is that the Cairns variant?
The Brisbane. Yeah, the Cairns is Omicron and the Brisbane is Omicron-like.
Background for that South African case in Brisbane, when was that detected?
It's a few days ago. I'd have to have a look. I think we might have announced that we had that case on Sunday or Monday, saying that we had one. We've been able to confirm it wasn't Delta, but we weren't sure what it was. So that was that one. And then the Cairns gentleman arrived, I believe, into Queensland on the 3rd of December.
The government has previously done recruitment drives to try to fill in those positions in hospitality and tourism. Is there any plans to do that now that the border's opening? There's quite a lot of people around the state that have had to hire staff that don't have the people there to...
Yeah, and look, there's a lot of work being done with the tourism sector to attract people generally, both tourists and workers, to come to Queensland. We know there are thousands and thousands of people wanting to come to Queensland, not just returned Queenslanders and not just holiday makers, people who are planning on relocating here, making this their home. And why wouldn't you? And look at how well we have managed COVID. That's why so many want to come to Queensland. So I'm hoping there's a whole lot of people interstate, no due respect to New South Wales and Victoria and the ACT, and now South Australia, but there's a whole lot of hospitality and tourism workers in those states who think Queensland would be the best place to be as we manage this virus starting to move through our community because of the way we've managed it so far. And, to think you can work in Winton or Longreach, or you can work in Cairns or Townsville, the Whitsundays as a hospitality worker here on the Sunshine Coast, Brisbane, Gold Coast, all these amazing places we have. Anyone who's watching this, who's wanting a job in the tourism sector, come to Queensland.
Minister, I just had a question from our Bundaberg Bureau. Children concerned they won't have a doctor at their hospital over the Christmas period, and those who need emergency care will need to travel 45 minutes to Bundy. What's your response to these?
Look, I'm happy to look at that and see the circumstances, whether there's a vacancy there or whether they're getting a locum in. Happy to follow up on
When
that.
can the education sector expect to see the health directive for the vaccine mandate? Because they've got a plan now over the school holidays when all teachers are on leave. When
Sure.
can they expect that detail?
Look, that's being worked on at the moment. I would think that's only a matter of days away. We know that it's important to get the directive out where it's got the details, but the directive is pretty clear. If you are if you're an education worker, if you're a teacher, if you work in schools, if you work in early childhood education, if you work in correctional services or youth detention, you must be vaccinated, and the dates have already been announced. So the best thing everyone can do is get on with getting vaccinated to ensure that, especially when we open our schools in the new year, that we have the staff that are vaccinated. And I'm hoping once we open up the vaccination to our 5 to 11-year-olds, that a lot of families take up the opportunity to get those children vaccinated before they start the school year.
Which hospital is the Omicron patient in Brisbane?
I'd have to. Do you know which one?
I'd have to confirm
Well,
that.
we'll follow up for you.
Are most of those 40 active cases in South East hospitals? Are they all in?
No, they're not all in hospitals, but I think the majority are at the moment. Again, just to watch them closely, we've got 3 large family groups. So when you've got children infected and parents, obviously we don't separate them. So many of those are being cared for in our hospitals at the moment. The great news is we have no one in ICU at the moment with COVID. Thank you.
Thank you.
Just kidding.
I thought it was